In the kingdom of endocrinia, the royal balance of calcium was vital for strong bones, healthy nerves, and a steady heartbeat. But sometimes, the scales tipped, and too much calcium flooded the kingdom, a condition called hypercalcemia. The royal doctors set out to discover why. The two main roads to hypercalcemia. I. The PTH-mediated road, the parathyroid path. Primary hyperparathyroidism. The parathyroid glands, like overzealous tax collectors, sent out too much PTH, commanding the bones to release their calcium treasure. Most often caused by a parathyroid adenoma, sometimes by hyperplasia or, rarely, carcinoma. Serum calcium was usually less than 12 mg per deciliter, over 13 mg per deciliter was rare. Familial menae and menae. In some royal families, a genetic curse, multiple endocrine neoplasia, led to overactive parathyroid glands. Familial hypocalciuric hypercalcemia, FHH. A rare family trait where the calcium-sensing guards were lazy, so the body needed higher calcium to turn off PTH. Resulted in mild hypercalcemia and low calcium in the urine. Tertiary hyperparathyroidism. After long-standing kidney trouble, the parathyroid glands became independent and kept making PTH even when not needed. 2. The PTH-independent road, the outsider's path. Malignancy. Evil tumors sent out messengers, PTHrP or cytokines, or invaded the bones, causing them to release calcium. Most common when serum calcium was over 12 mg per deciliter. Vitamin D intoxication. Too much vitamin D, from pills, ointments, or certain diseases, made the gut and bones pour out calcium. Chronic granulomatous disease. In conditions like sarcoidosis, the body made extra vitamin D outside the kidneys, raising calcium. Medications. Thiazide diuretics, reduced calcium loss in urine, especially if bones were already leaky. Lithium, could make the parathyroids overactive. Teriparatide, a bone-building drug. Excessive vitamin A. Too much retinoic acid made the bones give up their calcium. Theophylline toxicity. Sometimes caused high calcium, but could be fixed with special medicines. Miscellaneous causes. Hyperthyroidism, thyroid hormone made bones leaky. Acromegaly, pheochromocytoma, adrenal insufficiency, immobilization, parenteral nutrition, milk alkali syndrome, rhabdomyolysis, and acute renal failure all had their own ways of tipping the calcium scales. The special cases. Milk alkali syndrome. Too much milk or calcium carbonate led to high calcium, kidney trouble, and metabolic alkalosis. Rhabdomyolysis and acute renal failure. Injured muscles released stored calcium, and the kidneys couldn't keep up. High calcium intake. Rarely caused trouble unless the kidneys couldn't get rid of the extra calcium, as in CKD or milk alkali syndrome. The trickster, pseudohypercalcemia. Sometimes, the total calcium looked high, but the active, ionized, calcium was normal. This happened when there was too much protein in the blood, like in dehydration or multiple myeloma.